Shalom and good morning to us all. Due to the new developments with the COVID-19, particularly in our country, it's become necessary for us to go over a few things that we learned in the past during some of our teaching services, and also learn a few things that will help us protect ourselves and keep ourselves safe. So today the health committee will take us through a few things that we need to know. The coronavirus spread is increasing all over the world, as we already know. There are about 2.8 million cases worldwide now, and 1.2 cases in Ghana. The main concern now is that most of these cases are by community spread. By community spread, I mean that in the beginning, we thought that most of the cases were being spread from those who traveled into the country to their close contacts. But now those contacts are also spreading it to others. The other challenge here too is that most of these people are asymptomatic, meaning that they have no symptoms or signs that would make you think that they have coronavirus. If you remember, we discussed earlier that some of the signs included coughs, sore throats, chills, fevers, and so on. These signs, although are still present in those who have the condition, there are a few people who are walking around who have the disease or have the virus but are not yet showing symptoms and are the ones who we need to be concerned about. The key, therefore, is to act like everyone has the virus. This means that you act like you yourself have the virus and anyone you come into contact with has the virus. So do not go out unless you really have to. If you have to go out, then you have to avoid crowded places and people being in close contact with people. You keep a distance of 1 to 2 meters between you and the next person. If you are not too sure how 1 to 2 meters is, just decide that if you can stretch your hand out and touch the next person, then you are too close to the person. Wash your hands under running water as much as possible. This is very important. You keep washing your hands as many times. It doesn't matter if you have to do 10 to 50 times a day. When you don't have water to wash your hands, you can use the hand sanitizers. But don't make it a habit to use the hand sanitizers only, especially because as you use the sanitizers, it leaves residue on your fingers and your hands, which makes it easier for the virus to attach if you become exposed. Do not use apeteshi, gin, or any kind of drinking alcohol, since they do not have the required 70% alcohol. The thing is that sometimes people claim that because they are also forms of alcohol, you can use them to wash your hands. But alcohol that can kill the viruses must be at least 70% of concentration. And for most local gins, the highest can get to is about 50-51%. So they are not protective. Eat lots of fruits and vegetables and drink a lot of water. This will help boost your immune system and protect you from the virus. WHO still maintains that people who are caring for sick or have the virus should wear masks. However, we have found that in places where they have made wearing of masks compulsory, it has helped to improve the health and also reduce infection rates. So in spite of this direction of the WHO, we think that's a good advice that if you are stepping out, you put on your mask. Now, there are a few types of masks on the market that people are using. There's a cloth mask, then there's a surgical type mask, and then there's also the N95. The cloth type mask has less protection for the wearer. However, it seems to protect against droplets for those who are close to the wearer. It's less expensive and it's usually reusable. The surgical masks are usually more expensive, but provide or offer better protection than the cloth masks. Then there are also the N95s. The N95s are usually reserved for working in healthcare conditions, like doctors and nurses attending to patients. It is not advisable to spend so much money on N95s unless you are in a community or an environment where you are largely exposed to patients who have the condition. So, in a few minutes, I'll demonstrate to you how to put on the masks. So I'm going to demonstrate to you how to put on the various types of masks. We'll start with a cloth mask. So this cloth mask has strings that you tie to the back of your head. There are some that have strings that are elastic for your ears. Some also have different colors on the inside and the outside, but this one has only one color. So we just demonstrate with this. The important thing is to make sure that your mask has good integrity. That is, it's not torn, there are no holes or any damage to the mask. So when you are wearing the mask, you make sure that the pleats face downwards. To wear the mask, you first hold the strings by the top strings first, put it to your face, then tie above your head. Then you hold the lower strings, hold them so that the mask covers your nose and your mouth. Then you tie behind your neck. It should fit nicely on your face to cover your nose and your mouth. To take off the mask, you first release the strings behind your neck. Then you lean forward and release the strings on your head and drop it into a bowl of soapy warm water. Then there are the surgical masks. So this mask, for this surgical mask, you have the elastic strands. So for this, it has a blue color for the outside, white color for the inside. And then you find that there's this harder part that has a piece of metal at the top. This is for the nose. So you hold it like this to your face, over your ear. You pull down to cover your face. Then you press on the nose piece to keep it fast. Also, to remove it, you move forward, hold the strings, take it off, and dispose in a bin. So when wearing the mask, there are a few do's and don'ts. First of all, you don't tie the masks with the strings crossing each other. I'll demonstrate. Do not wear the mask like this. Always wear it like this. Again, do not wear the mask below your nose like this, or below your mouth like this. You should always cover your nose and your mouth. When wearing the mask, avoid touching the front of the mask, as this may have contamination that may put you at risk of infections. When taking off the mask, do not take off the top string first. If you do this, the mask falls to your chest and your clothes and contaminates them. Always remove the string behind your neck first. Lean forward. Then take off the top string and drop it into soapy water. Always remember to wash your hands with soap and running water before wearing your mask and after taking off your mask. If you don't have soap and water, you can use the hand sanitizer. So although the lockdown has been lifted, we still advise that as much as possible, you stay at home and stay safe. Avoid crowded places, and as much as possible, avoid leaving your house if you don't really have to. If you have to, put on a mask as we have advised. Also, although you may be experiencing anxieties and panic regarding this condition, we ask that you try as much as possible to stay calm, as you are less likely to make mistakes if you are calm. Also, eat lots of fruits and vegetables and drink a lot of water to boost your immunity. As has been said, stay home and stay safe. Thank you.